have been joined by none other than Dr. Oxiris Barbot, and I am so thrilled that she's with us. I want to say a word or two about her. Dr. Barbot has been an incredible partner for me, and she is brilliant. I don't use that word lightly. She is fearless, absolutely determined to push science and the interest of the public at every moment in this crisis, based on data, based on research, based on the best consensus of the medical profession. This is the kind of leadership that we need. And it has truly been an honor for me to work with her. And I'll tell you, I sleep better at night knowing the caliber of leadership we have at the city's health department, the best big city health department in the world. Dr. Barbot, of course, leading that agency, but many great people on her team as well that I'm pleased to work with. La comisionada ya vino a nuestro Zoom y pronto vamos a escuchar algunos comentarios de ella, pero quiero que sepan ustedes que ella es una comisionada, una líder brillante, tremendo liderazgo, que ha sido para mí un honor trabajar mano a mano con ella, que no tiene miedo a nadie. Ella siempre se basa todo lo que dice en la ciencia, en lo que están diciendo los médicos. Este es el clase de liderazgo que hace falta hoy día en medio de una pandemia. Así que con ustedes en unos breves momentos, la comisionada. And now, Commissioner Barbot, Dr. Barbot, thank you for joining us. I'd like to turn it over to you for a few opening remarks. Thank you.
Thank you, Mr. Chair. Can you hear me okay?
Yes, we can hear you and see you. Thanks. Bienvenida.
Fantastic. Gracias. I had some technical challenges, and as you say, it's our new reality. Pero aquí estamos. Y muchísimas gracias por su introducción. I'm honored to be able to work with you as our chair of our health committee. It's been an incredible partnership, and I thank you for your support during this pandemic and being a leading voice in making sure that we follow science.
Right.
We lead New Yorkers. So muchísimas gracias a usted, a su liderazgo como el presidente del Comité de Salud del City Council. Ha sido un honor estar ahí con usted lidiando con las cosas que están sucediendo y lo que le está afectando a nuestra ciudad. What I thought I would do just as a few opening remarks is to kind of give a summary of where we are in this pandemic and where we need to go. And then I am excited to take questions from your constituents, and we'll see where this conversation takes us. Right now, I want to just give everyone an overview that we are still in the midst of an unprecedented health event. This pandemic certainly is one that has demonstrated itself to be a vicious virus. We have over 140,000 people that have been documented with a test to be positive, but we know that that's the tip of the iceberg, that there are thousands, if not tens of thousands of New Yorkers that have been exposed, dare I say hundreds of thousands of New Yorkers that have been exposed, but that have heeded our recommendations to stay home and for 3 or 4 days, and then only if their symptoms are getting worse should they then be seeking medical care. And the good news is that that approach has gotten us to where we are now. And let me just sort of review that en español un poquito antes de seguir. Estamos en medio de una pandemia que no anticipábamos estar. Obviamente es algo completamente nueva en nuestra ciudad, en nuestro país, en el mundo. Y ha sido algo, un virus bastante agresiva y ahora mismo tenemos más de 140,000 personas que están afectadas por este virus, pero sabemos que muchas más se han contagiado también, pero que han oído nuestras recomendaciones, que se queden en la casa si tienen síntomas leves y que no vayan a los hospitales, pero que sí vayan si se están empeorando o no mejorando después de 3 o 4 días. Y que ahora mismo lo que nos está ayudando más como una ciudad es que la mayoría de neoyorquinos sí se están quedando en la casa y esto está salvando vidas. So right now at this point in the pandemic, we are seeing the fruits of New Yorkers staying home and adhering to the recommendations of sheltering in place, of using a face covering if they do have to go out for essential activities, and certainly maintaining a 6-foot distance from their fellow New Yorker. Really, this is, I think, an evolution of the science that we have been learning about this virus. You know, we've said from the beginning that we're learning every day about how this virus behaves, not only from the epidemiologic and public health point of view, but also from the clinical point of view. It's a virus where initially, you know, we believed that the lungs were the primary organ that were being affected, but every day we're learning more and more about all of the ways in which this virus affects the body, both in terms of the devastation of people's kidneys and the number of people that we're hearing about on dialysis, the number of people whose hearts are being affected. So, you know, it's a grim reminder that we are still learning about this virus. But in spite of that, and in spite of the really devastating toll that this virus is taking on our city, on our country, and the unthinkable number of, unfortunately, New Yorkers that have died because of this virus, there are things that we can do on an everyday basis to continue to save even more lives. And we need New Yorkers to continue to do the stay at home, face coverings, and the 6-foot distance. Now, with that being said, we are, I would say, almost 2 months into this, and we have set out, Mayor has set out in his daily press conferences 3 data-based indicators that we are monitoring on a daily basis, so that when we make decisions about potentially lifting social distancing measures, we do it based on the best science. We do it based on the best data that's available to us here in the city. And so it's a combination of looking at the number and the percent of people across the city that test positive, the percentage of people that test positive through our public health lab, and that's really more an indication of people that are seriously ill and are in the hospital, along with a combination of the percentage of people that get hospitalized for pneumonia-like illnesses because of COVID-19. And then lastly, an indicator looking at the number of intensive care beds that are being occupied in our health and hospital system. So all of that taken together gives us a very comprehensive picture of where this virus and where these infections are headed. That being said, I think we have made significant progress since the beginning of March, and things are looking to be in the right direction, but they are not yet where we need them to be. And all the more reason why we need New Yorkers to stay home, to seek care if they're not getting better, and to maintain the use of facial coverings as well as the 6-foot distance. So I guess I will talk about one more thing and an overview, and then maybe we'll just open for questions, if that's okay.
We do. We have many questions people are excited to ask.
Yes.
Already come in.
And so the only other thing I would mention is that we are seeing inequities in the number and the distribution of people that are dying because of COVID-19. Certainly, you know, early on, we were highlighting that we anticipated individuals who were elderly and those with chronic underlying illnesses would be at the greatest risk for death because of COVID-19. And sadly, that has come to fruition. I think one of the other things that I just want to be very open about is that, you know, for all of us, it feels like we've been fighting this pandemic forever. And the reality is that it has only been a few weeks. And we have learned a lot in that short amount of time. And what we're seeing is that Black and brown people are dying at twice the rate as white people in this city. And we are putting measures in place to address those inequities, measures that range from increasing the number of sites where people can get tested, increasing the direct outreach that we make to communities that may be linguistically isolated, that may have challenges with access to medical care, or for whatever reasons, the messages that we're putting out into media haven't been reaching them. So we've done robocalls. I've recorded robocalls in English and in Spanish that have gone to over 1 million households. We are about to launch direct mailings, sharing information to each and every household, not only on the symptoms of COVID-19 and what to do if an individual is developing those symptoms, but also how to care for someone in your household who may be developing symptoms or may be sick with COVID-19, so that other people in the household don't become ill with COVID-19, and how to care for elderly individuals in a household. And then to just add one more piece to that equation, partnering with federally qualified health centers so that we can provide alternatives to housing when there are family members who are living in housing situations where isolating at home is just not feasible, and providing them opportunities to do that in places that are safe and that can provide them access to the types of wraparound services like food, for example, that will make it easy for them to ride out COVID-19 at home. And so I think with that, I will end, and Mr. Chair, I will hand it over to you to moderate questions.
Thank you, Commissioner Barbot, for that very important overview. And I want to get right into the many great questions that we have. La primera viene de Norma Campuzano, que es una líder muy respetada aquí en Washington Heights, que ha preguntado, si uno se recupera del virus, ¿cuáles son las posibilidades de que se le infecte de nuevo? So Norma Campuzano, who's a respected district leader here uptown, has asked something that's on a lot of people's minds. If you recover from the virus, what are the chances that you could get infected again?
You know, that is a very important question. And let me start off by saying that it's not an easy answer, because we are still learning every day about this virus. And I think especially now we are hearing more and more about antibody tests. And let me just I'm going to give a little bit long-winded answer, but I think this is an important thing to get clear, and so that New Yorkers understand what antibodies can and cannot do. So antibodies are a part of the body's normal reaction to whenever they are exposed to a new virus or bacteria. And basically, it's indication in your blood that your body was exposed and it was able to fight against it. And normally we say that antibodies are an indication that you were able to clear an infection. And normally we say that, especially when it comes to things that are viruses, it gives you a certain amount of immunity. Not 100%, but a certain amount of immunity. In this situation related to COVID-19, none of us, this is one of those times when I can make an absolute statement to say none of us have ever been exposed to COVID-19. It's a brand new virus. And so because 80% of the people who do get COVID-19 will have a mild course and they'll be at home. And when they do develop those antibodies, one of the things that we still don't know is how long those antibodies will last, and if and to what degree they will offer protection, and how long that protection will last. And so what we are seeing is that there are studies coming from around the world where people are starting to look at the question of antibodies to make more informed decisions about what it really means. And there are very limited studies, but they're out there anyway, that say that there have been individuals who have gotten reinfected after getting COVID-19. Now, there's a lot of uncertainty there, but I think it's important for us to have that in mind for when we hear about all of these other antibody tests. I want to say one more thing about antibodies. There are new tests that are being developed, and these tests look for antibodies that have fought off coronaviruses. Now, the other thing that it's important for New Yorkers to know is that COVID-19 is part of a family of coronaviruses. It's a new strain in a family that already had 7 strains. 4 of those cause the common cold. 2 of those cause really terrible diseases, SARS and MERS, and now COVID-19, the new one. And so some of these new antibody tests can't really tell with any kind of certainty whether the antibodies that they tell you that you have are to the COVID-19 coronavirus or to one of the 4 coronaviruses that cause the common cold. So that's why when people get tested for this antibody, and they may come out positive or they may come out negative, the underlying guidance doesn't change, which means we need you to stay indoors, we need you to keep wearing your face covering when you go outside, and we need you to keep that 6-foot distance when you do go outside. Ahora, para decirlo en español, lo voy a hacer más breve. Lo que estamos aprendiendo de este virus es algo nuevo cada día. Los científicos han desarrollado un análisis que se puede hacer en la sangre para determinar si el cuerpo ha venido en contacto con el virus y ha podido sanarlo. El problema es que no se puede decir con seguridad si esa protección va a ser algo que va a durar toda la vida de una persona, si va a durar 1 año o cuánto tiempo va a ser que va a durar esa reacción, esos antibodies. Por eso es que si una persona se hace la prueba, aunque salga positiva o negativa, la recomendación sigue de la importancia de seguir usando la cobertura para la cara, para la nariz y la boca, y seguir aislándose en su hogar y solamente salir si es necesario y esencial, y que cuando salga mantenga su distancia de 6 pies a otra persona, porque hasta que la ciencia nos diga más sobre qué indica estos antibodies, no le podemos decir con seguridad que no se puede dar otra infección este mismo año con el COVID-19.
Thank you so much, Commissioner. Gracias, Norma. Ahora pasamos a una pregunta de Bobby Score, que es un líder sindicalista aquí en Nueva York, que pregunta, ¿cuándo vamos a poder volver a ver una obra de teatro? ¿Cuándo el sector de la farándula va a volver a poder trabajar? Bobby Score, who's a prominent union leader, has joined us and has asked a very important question. When will New Yorkers be able to return to see live entertainment and other forms of larger gatherings, whether it be Broadway shows and opera or the kinds of things that are so critical to the culture of New York City?
I think it's clear that our lives are clearly in a state that none of us would ever have anticipated. And, you know, the reality is that we are going to be in this new normal longer than any of us would really have anticipated, and longer than probably we will like. But until such time that those three indicators I talked about at the beginning, meaning the number of new infections, the percentage of positive infections, the number of people that are being hospitalized for COVID-like pneumonia, the number of people that remain in our intensive care units, until we see those three indicators go down for a sustained period of time, we can't take the risk of lifting those social distancing measures, because what we learned from the last time that our world was in a pandemic situation was that lifting these measures too soon caused a rebound effect and caused many, many more thousands of people to be infected and to die. And so when we do start lifting those measures, right, when we see those three indicators go down and it's for a prolonged period of time, we will have to take the equivalent of very measured small steps of lifting potential restrictions and then giving ourselves a period of time to see how many more new infections do develop. So the likelihood of us getting back to a time where we won't have to wear face coverings outdoors, where we will be able to enjoy outdoor activities and theater and opera to the same degree that we had just a few months ago, likely will not be for several months, if not a full year's time. This will take us a significant amount of time to get back to a true normal baseline. But let me just say, that's not to say that we won't find ways of continuing to enjoy life in New York City, that we won't find ways of being outdoors and enjoying each other's company. It'll just mean that we will have to do it in more measured and intentional ways.
Okay, thank you very much. We have a question from Yona Misalopolo, who is a dentist and is asking, when will dentists be able to reopen considering all the social distancing challenges? And I would add more broadly other forms of primary care. Tenemos una pregunta de una dentista que ha preguntado, ¿cuándo van a poder abrir de nuevo los dentistas que con la cuestión de distancia social también tienen que estar muy preocupados? Efkaristo, Yona, and we'll pass it to you, doctor.
Bien, gracias. Bueno, esta pregunta está relacionada a la que ahora mismo acabo de responder. So voy a empezar en español y entonces regreso a lo de inglés. El día, no se sabe exactamente cuándo es que podemos liberar algunas de estas restricciones en términos de cuándo podemos a regresar a nuestra vida, vamos a decir entre comillas, normal. Pero no quiere decir que no podamos regresar por lo menos a algo más o menos normal. Y para liberar algunas de estas restricciones, no hay algo fijo que se diga primero se hace esto, entonces se hace aquello, entonces vigilamos un poco más. Para decir que es posible que al principio, por ejemplo, se haga decisiones de liberar algunas de las restricciones en el sector de medicinas y de problemas para ver los dentistas. Pero ahora mismo es muy temprano para poder saber cómo es que vamos a liberar estas restricciones. So in English to say, we are a ways away from lifting some of these restrictions, and there's no playbook on the right way, quote unquote, to do this. And what we will take into consideration are what are those parts of our everyday living that we can then broaden perhaps the definition of essential. And it may end up starting with some aspect of medical care being opened up in a slightly broader form so that we can then determine what that does to the potential number of new cases. So it's hard to say specifically related to dentists, but I think more broadly, we can safely say that it will be one onion layer at a time.
Okay. We have a question from Jennifer Lopez, not the one who's buying the Mets, I presume, but if it is the same one, welcome, JLo. She's asking about whether for someone who has a mild case of COVID-19 or even an asymptomatic case, that whether there's going to be any lingering health effects, any damage to their lungs. And she's specifically asking about whether it could affect the reproductive systems of a woman who contracted the virus and recovered.
This is a very important question, and it goes to what I've been saying earlier, that every day we're learning more about this virus, both from the public health point of view, but also from the clinical point of view. And we are learning more about what this virus does to the lungs, to the kidneys, to the heart. I think that we are still in the very early stages of learning what it could potentially do to the reproductive system and to other organs in the body. So unfortunately, we don't know right now what those long-term consequences will be, but I do know that there are scientists across the country, across this globe, that are embarking on studies to answer those very questions.
Okay. Tenemos una pregunta de Gail Powell que ha preguntado, ¿cierto o no? ¿Los gatos se le puede dar el virus? Y si es así, ¿pueden infectar a los seres humanos? Gail Powell has asked the question, can cats catch the virus? And if it's true, could they pass it to humans?
We're hearing more recently that there have been documented cases where cats have tested positive for COVID-19. Thus far, there have been no studies indicating that humans have contracted COVID-19 from cats. What we are recommending is following CDC guidelines where pet owners limit the exposure of their pets to other pets, and that they take a measured approach to ensuring that pets that they have in the house stay in the house along with the rest of the family. So para decirlo en español, sí tenemos, hemos visto algunos casos documentados de gatos que han sido infectados por el virus, pero por ahora mismo no hay ciencia que documente que esos gatos han transmitido el virus a los dueños, y por ahora estamos siguiendo las recomendaciones del CDC que dicen que le aconsejan a los dueños de gatos y otros mascotas que los mantengan adentro con ellos y que limiten el contacto con otros animales.
Bien, tenemos una pregunta de María Lizardo, que es una líder sumamente respetada en el norte de Manhattan, que dirige una agencia sin fines de lucro, y ha preguntado, ¿cómo pueden empezar a planear para volver a trabajar en el local de la agencia siempre y cuando están los riesgos del coronavirus? Maria Lizardo, who is a prominent leader here uptown, she's the executive director of Northern Manhattan Improvement Corporation, has asked the commissioner, how can nonprofits start to plan for a return to the workplace given the concerns of social distancing and the ongoing risk of the virus?
You know, I think for right now, it's a situation where we are recommending, to the extent possible, deploying more distance activities, such as what we're doing now with regards to Zoom. For example, in the medical community, we are working with health providers to stand up more telemedicine, which doesn't necessarily mean doing Zoom or doing FaceTime. It can also include telephonic services. We are also looking to deploy socially distanced measures or ways in which community-based organizations can help support the recovery efforts that the city is putting underway. I would encourage you to check out the city's website, nyc.gov/coronavirus, where there is a host of information and ways in which CBOs can help contribute to this process.
Okay. We have a question from Gonzalo Casals, which is about mental health. And the question is, what is the mental health impact of this crisis, of isolation and anxiety and potentially depression? And just what can the city do to help for this challenge? Gonzalo Casals ha preguntado una pregunta muy importante acerca de la salud mental y cuál es el efecto de aislarse, de la ansiedad, de la depresión durante esta pandemia y qué servicio puede ofrecer la ciudad de Nueva York acerca de este reto importante. Commissioner?
You know, these times can be very challenging for everyday New Yorkers. And from the beginning, you know, I've been saying that reactions such as anxiety, depression, agitation are all normal manifestations of dealing with the stress of adapting to a virus and to a situation that are extremely scary, right? And where on an everyday basis, we are hearing of staggering numbers of people that are dying because of COVID-19. And that is throwing our everyday worlds into a chaos that none of us has ever really lived through in such a prolonged way, or I would not all of us, I would say most of us. And so we have been mindful of this and have a number of resources that we are directing New Yorkers to. I think the best resource that we can direct them to is to NYC Well. It's a service where either by phone, by chat, by text, New Yorkers can have 24/7 access in a number of different languages to be able to talk through the anxiety, the depression, the stress reactions that they may have. And certainly it's an opportunity to also then be linked to more intensive mental health supports. But I think the most important recommendation that we make is that though we are asking New Yorkers to remain physically distanced, we are asking all New Yorkers to remain emotionally and spiritually connected, and touching base with your neighbors either through the phone or through the door. There are ways in which we can easily remain connected without necessarily having it be in person. And that those small outreaches can make a huge difference. And, the fact that we are all in this together, it's going to take all of us to get through this. And it's going to take all of us to adhere to social distancing, and it's going to take all of us to really dig into the grit of New Yorkers, dig into the resiliency of New Yorkers, and provide one another the support that's going to get us through this.
Excellent. Luisa, voy a preguntarlo, si uno ya se recupera del virus, ¿debería hacerse otro examen del virus para saber seguro si ya está libre del virus? Luis Savoy is asking, if one has the virus and recovers, later, should you get another test for the virus to ensure that it's no longer in your body?
That's a great question. And we are not recommending any follow-up tests to document whether or not you've cleared the virus. The important thing is that we're telling New Yorkers, if you develop symptoms of COVID-19, fever, cough, sore throat, general achiness, and you to stay home for 7 days from the beginning of your onset until you're totally better, or 3 days after being without a fever and not have anything on board like Tylenol or ibuprofen, that's really the best indication of whether or not you've cleared the virus. The tests that we do to determine whether or not someone has COVID-19, it looks at the RNA of the virus. It looks at the genetic material of the virus. It doesn't look at whether or not that genetic material is viable or not. And so that's why we've made such a point of telling New Yorkers that if you don't have symptoms, it doesn't necessarily make sense to get tested, especially if you've already cleared your symptoms. And I realize that as I say this, the science has shown us that people who are pre-symptomatic can shed the virus. So it's an evolving situation. But that being said, once your symptoms have cleared, there have been documented cases where people have had the same test done that looks for and I'll call it the carcass of the virus in the blood, and they will find it. And there have been cases where people have been tested like 3 weeks out, and it's still positive. Doesn't mean that they're spreading the infection. It just means that it's taking that much longer for the virus to be cleared. And so there is no indication currently for there to be a follow-up test to be done. And we are recommending that, or we're advising that once 7 days after being from the onset of your symptoms, 3 days without a fever, you should go back to sort of your new normal, which means staying home, using a face covering if you've got to go out, and keeping that 6 foot distance. So you'll see that the guidance doesn't change whether you've had the illness or not, because when you're in a period of widespread transmission, which is where we are on a daily basis, we still have roughly more than 2,000 people newly diagnosed with this illness. So it's still out there. The guidance is still the same. Stay home, use your face covering, keep that 6 foot distance.
Voy a decir una breve resumen en español para seguir con las preguntas, pero la comisionada ha dicho que no es recomendado hacerse otro examen después de haber recuperado del virus, y después de 3 días sin fiebre, o por lo menos 7, después que comenzaron los síntomas, usted ya no debería de ser contagioso y podría volver al público siempre y cuando se tape la boca. Todo el mundo tiene que seguir tapándose la boca para no correr el riesgo de infectar a otro gente. We have a question from Sean Slavin about the new hotel program that the city is launching, which is for those who are not so sick that they need the hospital, but are sick enough that they shouldn't be home because of the risk of contaminating their family. And Sean asks, as a follow-up, what about the role of these hotels in providing safe places for homeless New Yorkers? Brevemente en español, Sean Slavin ha preguntado, ¿cuál es el nuevo programa que ofrece la ciudad de Nueva York, hoteles, para quienes necesitan aislarse de su familia y los que están sin casa, los desamparados, que también necesitan dónde estar sanos y seguros? Así que, comisionada, por favor.
So, este nuevo programa es para personas que no se pueden aislar en su domicilio. O sea que independientemente de si sea una persona desamparada o que viva con varias personas en su casa, estos hoteles van a ser para esas personas. O sea, para empezar, si una persona vive con una familia y ese apartamento, esa casa, tiene otro dormitorio o una área en ese domicilio donde la persona se pueda quedar aislada, tenga un baño separado, se puede quedar en ese hogar. Pero si es una situación donde no es posible, es un apartamento pequeño, hay varias personas viviendo en el apartamento, entonces estos hoteles son para esas personas poder aislarse seguramente y también para los desamparados. So in English, these hotels are for anyone who is unable to self-isolate safely, whether they are homeless or whether they're living in a apartment situation where there may be many individuals living in that apartment and it's not feasible for them to be able to stay alone in a separate room with their own bathroom. And so these hotel rooms will be critical as we get closer to the stage of very low transmission. And they will be pivotal in ensuring that we stop the lines of transmission when new cases get identified.
Okay. We have a question from Allegra Legrande about transparency and reporting, which of course the public wants and needs, and specifically the questions of, can we get more frequent than weekly updates on the racial breakdown of coronavirus in New York City? And perhaps you could also address the question of how we're counting deaths, which I'm not sure if Allegra asked specifically, but others have, and whether there are plans to adjust that or expand that in any way. Allegra La Grande ha preguntado cómo el público puede recibir informes más a menudo del Departamento de Salud acerca de los datos cuando se trata de los números por raza y el número de muertos por causa y por categoría. So please, Commissioner.
Absolutely. So let me start with how we count deaths. Up until recently, we were limiting reporting on deaths to individuals that had a test done. Part of that was because there was no standard definition about what were the symptoms, what were the other components that could be consistently applied to deaths to count them as probable COVID-19 deaths. The federal government and an oversight body finalized their definition, finalized their guidance to doctors and funeral home owners and to medical examiners so that we could all use the same definition about what it meant to be a COVID probable death. They did that early in April in preparation for ensuring that all New York City professionals who are authorized to register deaths. The medical examiner did outreach to hospitals. We did outreach to funeral homes. We updated the online registration system that we have for birth and death registration, our eVitals. So all of that went into effect. Wow, it feels like a lifetime ago, but it was probably more like 2 or 3 weeks ago. And so we are one of only 2 cities in the country that report on probable deaths, because we are one of only 2 cities that have that responsibility. Everybody else is a state. And we are committed to ensuring that we have transparency in the data that we release. And actually, during this pandemic, we broke one of our own rules, meaning that we posted data before it was complete, because we knew how important it was to make sure that we had information about the racial makeup of how people were being affected by COVID-19. And so that's part of the reason why, until we get all of the racial data completed, we're going to keep reporting it on a weekly basis, because of the technical and hospital and funeral home issues that have to still be resolved in order to get complete and consistent data. I think that we are almost there, and my hope is that we will be able to report on that data more frequently. But we're committed to the transparency. We're still reporting on the data, even though it's not 100% complete, because we know that it makes a difference to how we respond to this virus.
Okay. We have received a number of questions on what are known as live animal markets or wet markets that have been implicated in the origin of the virus in China. And there are, of course, some of these in New York City. And perhaps you can address the extent to which you assess there being risk for virus transmission in such venues, and the city's role in regulating these venues, and whether there's any plan to reconsider all this in light of coronavirus. Hemos recibido varias preguntas acerca de lo que son conocidos en español como viveros, donde venden su pollo en vivo o otros animales, porque hay sospecha de que en China fue donde se originó el virus, el coronavirus, en uno de esos mercados, y hay varios acá en Nueva York, y queremos saber cuál es el riesgo de que se pase de un animal a un ser humano el virus en uno de esos locales. Please, Commissioner.
Great, thank you. And unfortunately, I will have to have this be the last question, because I need to go on to my next.
We totally understand, and we are grateful for your time.
Thank you, thank you. You know, I will start answering that question by saying that there are recent reports that actually indicate that the coronavirus that we have here in New York City actually was introduced through Europe. So it goes against sort of the early narrative that this was a virus that came exclusively from the Wuhan area of China. And so I think it's important to take this opportunity to remind New Yorkers, A, that this is about a virus transmission, not about individuals who may be carrying viruses, and that viruses don't respect borders. And so we actually have evidence that the virus that was transmitted here in New York City was not exclusively from China, but was introduced through Europe. With regards to the live markets, we work collaboratively with the state of New York, who has oversight over those markets. And in all of our investigations doing contact tracing for early cases of documented COVID-19, we did not find any nexus with any of these markets. So I think that's a good way for us to end in putting to rest some of the rumors that may still be floating around there with regards to COVID-19. Mr. Chair, I want to thank you for convening us. I want to thank you for your leadership, and I want to thank you for being such an active and vocal advocate for science leading our response. So thank you very much.
Thank you, Commissioner, first for spending an hour with us and our community and answering so many questions, and more importantly, for your ongoing leadership of the Department of Health and Mental Hygiene during this crisis. Thank you for all you do and for your partnership. Gracias, comisionada doctora Oxiris Barbot, por compartir con nosotros durante esta horita y por todo su liderazgo en el Departamento de Salud durante esta época de crisis. Se lo agradeceremos, and we support you and salute you and wish that you remain healthy throughout this difficult time. Thank you, Dr. Barbot, and thanks to all of you who have joined us on this Q&A. We're doing these regularly. We'll do many more. So to those who didn't get your question asked, please come back next time or find me on social media, tweet at us, visit us on Facebook. We are here to support you throughout this pandemic as long as it takes. Muchísimas gracias y buenas noches. Thank you all. Stay safe.
Gracias.
Bye-bye.